Good evening, everyone. I am Captain Vipul Choudhary, co-founder of Values Network and founder of Olive Green Consultants. I am a BA Law and MBA Finance, and I've been in the financial services industry for last 16, 17 odd years out of a total experience of 23 years. आज का जो टॉपिक है वो है about healthcare and ECHS, also corporate insurance, etc. Idea being that healthcare, or rather to say, a medical ailment can actually be a financially very, very difficult and crippling expense for an individual oblique a family. So, how well prepared are you? How adequately you have provision for it? इसके बारे में आज थोड़ी सी बातचीत करेंगे and I'll share my views, and once I'm done, you are most welcome to go ahead and ask your questions with reference to the context of the talk today. So, the touch points would be: one, we'll discuss what ECHS is. Second, we'll discuss अगर आप में से जो पहले छोड़ देते हैं फौज की नौकरी, शॉर्ट सर्विस ऑफिसर्स हैं या वॉलंटरी रिलीज पर बाहर जाके कॉर्पोरेट में काम करते हैं, तो कॉर्पोरेट्स भी आपको कुछ हेल्थ प्लान्स देती हैं. क्या उसके बाद इज देयर अ रिक्वायरमेंट फॉर यू टू बाय अ फैमिली हेल्थ इंश्योरेंस और नॉट? We'll have a discussion. So let's start this, and I have a small presentation just to keep the conversation focused. So the question which we'll be answering today is ECHS oblique a corporate health insurance sufficient for your needs, or do you need anything beyond that? So that's the question we'll be working on. First of all, need to understand what is ECHS. It has been developed on the lines of the CGHS, which is Central Government Contributory Health Scheme. And technically, it is a scheme. There is no capping, or there is no. It's a cashless scheme with no capping. That means any family which is a beneficiary of ECHS after having subscribed to the ECHS scheme is supposed to be getting capless as much as the expense is. They are supposed to be getting a reimbursement on that, or rather to say cashless facility on that, not a reimbursement. So it is capless. There is no cap on the amount which can be spent for an ECHS beneficiary under the ECHS scheme, and it has to be cashless. The basic consultation, essential investigations, medicines, etc., are managed through a network of polyclinics. So, as to say, the outpatient care or the OPD, that is managed through a network of polyclinics which are conveniently located, and they try and locate it within the existing infrastructure of the armed forces to keep the costs under check. There are doctors available for outpatient care, essential investigations, and medicines which are given on an ongoing basis. For the inpatient care is when an individual needs to get hospitalized for maybe a surgery or a procedure or an intervention, etc. Then, as a model, care capacity of the service hospitals, that is the base hospital, the military hospitals, the command hospitals, and if need be, the RNR, any other government hospital which has a tie-up with ECHS, or impaneled private hospitals. That is where an ECHS beneficiary is expected to go and get the inpatient treatment for any kind of a process or a procedure or surgery or a interventional medical care. Some more details about ECHS as available on through the government press release. This is the latest which was available on the government press release, which was released by the Ministry of Defense on 24th of March. That is around 2.5 months ago. So as of today, the scheme in 2022 had 58 lakh 80,023 beneficiaries. So this includes the families, the individuals, officers, non-officers of all the three services. And then they also included the pensioners of Imperial Army, Defense Service Corps, Uniformed India Coast Guard, the military nursing services, Special Frontier Force, and also extended it to the Nepalese domiciled Gurkha soldiers, etc., whole time NCC officers, and some of the people who are in the ambit of the defense forces. As of 2022, the scheme is now administered to 1 crore 53 lakh 875 beneficiaries, which is almost double of what it was in 2020. The expenditure, if you can see, in 2021 was 4,579 crores, and in 2023 it is 4,897 crores. So while the beneficiaries more than doubled, or rather more than went 2.5 times, the expenditure has not been increased in the same proportion or at the same rate at which the initially what was provisioned is still what it is maintained. And then the number of empaneled medical facilities, Andhra Pradesh 67, 22, Delhi has 274, Haryana has 368. All these are a lot of empaneled facilities which are there in when it comes to ECHS and the other facilities or people who are covered under ECHS. That's what the government has stated in its own paper. Now, here comes the next reality. Reality check is that ECHS as of today is an overloaded system. As you had seen in the figures quoted by government, in 2022, there were 58 lakh beneficiaries. In 2020, in 2022, there are 1 crore 53 lakh beneficiaries. So that is more than 2.5 times, almost 3 times. But the expenditure has not risen 3 times in the last 3 years. Therefore, whenever, and it is a common thing now in NCR, oblique the metropolis, or where the in bigger cities, where private hospitals will routinely deny medical care or admissions to the ECHS beneficiaries on one reason or the other. They'll say either the beds are not available, or if they are available, then certain procedures are not available, etc., etc. Why is that so? Because in the bigger cities, even in smaller cities, hospital bills are routinely delayed when it comes to ECHS payment. The hospitals have a huge outstanding when it comes to getting paid from the ECHS, in spite of the fact that there have been agreements and representations. And as a result, so one, the ECHS rates are not at par with what the hospital can charge from a normal patient walking in, or anyone who is a non-ECHS beneficiary. So ECHS has made agreements with an hospital for a particular rate, which is lower than what the market rate is. And even then, even on those lower rates, the hospital bills get routinely delayed. The scheme as of today remains inadequately funded. It is not funded the way it should have been funded, so that the beneficiaries are able to get adequate and on demand healthcare from the best possible facilities available. Similar is the case for the in service or the existing infrastructure of the armed forces medical care. The hospitals which armed forces had, they were developed quite some time ago, and they have not exactly been upgraded with the changes in the modern medical care or with the changes in the modern healthcare, and therefore they are also not really equipped to be able to cater to the ever growing demand or the need of modern medical healthcare to the beneficiaries of ECHS, oblique to the officers and the soldiers who leave army and they need that armed forces rather, and they need the medical care. So what are the similarly people who join corporates? What happens is that they are at times given a corporate health plan, which again is a cashless, which is a group insurance, but this is only limited till the time you are on rolls with the corporate. The moment you leave that corporate, the moment you are out of that particular employer, or once you reach a superannuation stage, even in the private sector, you lose the benefit of being a member of a particular group and hence getting the advantages of the corporate health insurance. So where does this leave you and your family? Now we'll have a small discussion on the changing aspects of healthcare. अगर आप में से आज कोई भी recall करेगा, so like all other industries, healthcare has also undergone tremendous technological improvements. इसका recent example was COVID. COVID के अंदर the industry ramped up the vaccination output very fast, and within a year they were able to come out with a vaccine which was effectively able to combat the disease, provide immunity, and then they were able to ramp up the production also in a way that very soon it was able to reach vast swaths of population. Yeah, however, it remains a fact that there have been massive technological improvements in healthcare now. For example, and this is just an example which I've seen in my family. My grandmother was an arthritic patient, and till the day we unfortunately lost her, तब तक उनके घुटनों का इलाज नहीं हो पाया, and she had a very painful old age because of that. On the other hand, my mother, in her old age, she was able to go get a total knee replacement done because of the technology available today. And she, in spite of being an arthritic patient, she now has a far better quality of life in terms of pain management, in terms of day-to-day routine, etc. So, technological improvements have been massive in the medical stream in the healthcare industry, and they are now slowly coming to India also because of the fact that Indian economy is growing, Indian upper middle class and the middle class segment is growing. So because of these interventions, now the life expectancy for Indians is also continuously increasing, especially for people like those who are from armed forces, those who come out. They are comparatively better off people, so they have access to better healthcare, they are more aware, the hygiene levels are higher. As a result, their life expectancy is even more, which implies that with age, with time, their healthcare requirements continue to increase. And then another aspect which has changed about healthcare is the enhancement in specialization and interventional procedures. पहले के समय में when I was a child, there used to be one doctor who would probably be in MBBS and kind of a family doctor, and that particular doctor satisfies a lot of medical requirements of a family, and most of the times that doctor used to be a prescription doctor. That is, the doctor would prescribe some medicines, generic medicines, और उससे काम हो जाएगा. But now doctors are getting more and more specialized, and there are more interventional procedures. The doctors are now able to do a lot of operations, lot of diagnosis, lot of, so the surgeries have increased, which has in a way increased the medical care, which has increased the medical reach to an individual's body. और उसका अल्टीमेट फायदा ये है कि लोगों की जिंदगी की क्वालिटी भी बढ़ रही है और क्वांटिटी भी बढ़ रही है. प्लस नाउ देयर आर प्रिवेंटिव एंड स्पेशलाइज्ड डायग्नोसिस. अब डॉक्टर्स बहुत सारी चीजें, जैसे नाउ डेज बिफोर अ चाइल्ड इज बोर्न, इन द सेकेंड ट्राइमेस्टर, doctors are able to conduct tests which can actually run a huge battery of tests to ascertain whether this child will have some kind of a cognitive disease or not, or some kind of a congenital disease or not. So these kind of things they are then able to prevent those kind of births, or they're able to provide those interventions. Similarly, at advanced stages now, there are medical diagnosis available which can help individuals diagnose against a lot of cancer, a lot of other life-threatening disease. Then India is also now seeing a lot of introduction of specialized drugs which combat some rare disease, some disease more effectively as compared to non-generic disease. And medical care now in India is getting corporatized. When I was a child, most of the time a private doctor implied probably a medical practitioner, an individual, or maybe a small hospital, private lab or something. But now we have centers of excellence. We have hospitals like Manipal, we have hospitals like Medicity, we have hospitals like Fortis, Apollo, and they are growing, they are corporatizing, they are including new technologies, specialized procedures, specialized drugs, diagnosis, etc. So now दिखने में सुनने में ऐसा लगता है, बट हिंदुस्तानी अभी भी अपनी हेल्थ को, अपनी हेल्थ केयर को बहुत ज़्यादा इंपॉर्टेंस नहीं देते हैं. शायद ही बहुत कम ऐसे हिंदुस्तानी हैं जो रेगुलरली अपना डेंटल चेकअप करवाते होंगे, जो हर 45 के बाद में हर साल अपना फुल बॉडी चेकअप करवाते होंगे. वी आर नॉट रियली कंसर्न अबाउट आवर हेल्थ, नॉट बिकॉज वी डोंट वांट टू, or not because we don't want to live longer or have a quality of life, because One, we are not very aware. Second, healthcare is still an expense to us. हमें अभी भी लगता है कि यार इसमें इतना खर्चा हो जाएगा, मुझे फुल बॉडी चेक करवाने में 10,000 रुपये लग जाएगा, एक डेंटल चेक करवाने में 2,000 रुपये लग जाएगा. But the fact remains that quality healthcare is not just OPD. Quality healthcare is not just going to an polyclinic, getting your medicines, having a chit chat with the friendly doctor there. Quality healthcare, in fact, is invasive and interventional. For example, and here मैं आपको बताता हूँ, हमारे बहुत सीनियर, हमारे 2 बार के एक्स प्राइम मिनिस्टर श्री मनमोहन सिंह जी, he is now in his late 80s. He has undergone three, I guess, two or three bypasses. He's undergone knee replacements. He has undergone a lot of interventional procedures. And as a result, even as of today, he's hale and hearty. We wish him a long life. But the point I'm trying to make here is because he had access to that kind of specialized healthcare, he has been able to shoulder the responsibilities of being the prime minister of a country like India in spite of having these kind of life-threatening ailments, because he could get that kind of a healthcare available to him. So that's where the healthcare is changing. It is changing at a very rapid pace. हमें पता नहीं लगता है, but it is actually changing at a very rapid pace. So now the question you should be asking जो वहाँ से आता है कि are you adequately covered? अगर आपका corporate plan आज आपको available नहीं है, ECHS not exactly is there with where it should be, where you have an on-call kind of medical care. So do a reality check for yourself. What kind of a healthcare would you need at 55, 60, 65, 70, 75, 80, 85, and even beyond? Why not be a centurion? Have that long a life. And when you are doing a reality check of the expenses you need to make on these things, divided into at least four different categories. One, the diagnostic. What kind of diagnostic would be needed? And diagnostic is an expensive thing. What kind of test would needed to be run to understand what kind of disease you are fighting, or what kind of ailment is there which needs to be rectified or corrected or addressed. Then, what are the procedures? What kind of procedures are available for helping the individual in combating the ailment? What kind of procedures can be taken? What kind of procedures are available? What kind of procedures are available abroad? If by going abroad you can live for 5 years longer by doing a interventional or a medical care, then why not? Third, what are the aftercare needs once you have undergone a major surgical or an interventional procedure? What are the aftercare needs in terms of going to the doctor, getting paramedical, any kind of a fixture to be provided to you, any kind of a replacement, something. There are a lot of things which come along when major procedures are undertaken, and after that, continuous maintenance of that medical process. For example, unfortunately, some people, as a statistics, as a population, will get cancer. Then, what kind of a maintenance is required for them? Some people will have kidney ailments. What kind of a process is requirement to them? और इसके बाद में आप अपने इंडिविजुअल रिस्क फैक्टर्स को एसेस कर सकते हैं. व्हाट आर योर पर्सनल हैबिट्स, व्हाट इज योर वेट, पीपल लाइक मी हु आर ओवरवेट, आपके लाइफस्टाइल डिजीजेस क्या है, फैमिली हिस्ट्री क्या है, आपका खुद का एक्टिव है. इस सबको देख करके आपको ये एक्सपेक्टेशन या यूं कहे एक असेसमेंट करें कि आपको और आपके स्पाउस को क्या हेल्थ केयर की जरूरत पड़ेगी. ओके, गॉड विलिंग कभी भी ना पड़े, बट आई मीन दैट्स नॉट पॉसिबल. बट when you're 55, 60, I mean, when the body actually starts aging and when you need these things to make sure that you have a long and a healthy and a happy life. Once you have these answers, then you have to understand how much you want to enhance the span and quality of your life. अब जितना आप उसको बढ़ाना चाहेंगे, उतना आपको बेटर मेडिकल केयर चाहिए, उतना आपको बेटर नर्सिंग केयर चाहिए, और उतना ही आपको एक्सेस टू लेटेस्ट मेडिकेयर टेक्नोलॉजी. जितना आप अपनी जिंदगी की क्वालिटी को और स्पैन को बढ़ाना चाहते हैं. और ये सवाल आप खुद से पूछेगा, क्योंकि वी कम फ्रॉम country where initial struggle was to find first employment. And as Indians, we have now seen in the last 20-25 years the economy actually growing, and a lot of modern things being available to us. But if you are somewhere who is above 40, that's my age group. So we are born in a country which was more or less a socialist country leaning towards the government socialist policies. So we have not seen a modern economy. So our personal expense or our personal feelings towards our own health or our family's health are not really very progressive. Harsh truth, but that is what it is. But now you should answer this for yourself. How much money you are ready to spend on your own health? Because अगर आप ही नहीं है तो फिर बाकी चीजों का फायदा ही क्या है? So once you assess that, then you have to understand, is health insurance expensive? And should you take in health insurance in addition to ECHS or your corporate plan? So it is true that health insurance is an expense. खर्चा तो है ही, इसमें तो कोई डाउट नहीं है, आपको प्रीमियम देना पड़ेगा, वो खर्चा है. बट सवाल ये है कि should we purchase a health insurance as we are covered by ECHS and a corporate plan? A better sawal, or rather better questions to be asked is, one, how much health insurance do you actually need? Once you understand the features of ECHS, how much health insurance do you actually need? और ये बात मैं रिकॉर्डेड सेशन में बहुत खुल कर कह सकता हूँ. और मैं ये चाहूंगा कि ये बात कहते हुए मुझे कोई किसी भी तरह की खुशी नहीं है, बट अगर गवर्नमेंट ECHS को फंडिंग बेटर दे तो शायद फायदा होगा, नहीं तो ECHS के बेनिफिशरीज को एटलीस्ट एनसीआर में या बड़े शहरों में जहाँ पर स्पेशलाइज और बहुत अच्छी क्वालिटी की हेल्थ केयर अवेलेबल है, वहाँ रूटीनली मना किया जाता है. बिकॉज दी हॉस्पिटल्स आर नॉट इवन पेड एट दी रेट्स एट विच दे हैव बीन प्रॉमिस्ड बाय ECHS, एंड दैट्स एन हार्श फैक्ट. So either government does that. If not, then you should assess your needs for additional health insurance. How much you need, rather than do you need, because let me tell you, you need. How would you compare what all is available for our needs? किस तरह के हेल्थ इंश्योरेंस प्लान्स अवेलेबल हैं, आप उसको अपने ECHS या कॉर्पोरेट के साथ में किस तरह से मैचअप करेंगे, अगर जरूरत पड़ेगी तो आप इमरजेंसी में किसको यूज करेंगे. यू एक्चुअली शुड हैव अ प्रॉपर इमरजेंसी रिएक्शन, और मे बी अगर आपको ऑलरेडी पता है देयर इज अ डायग्नोज प्रॉब्लम और यू हैव अ फैमिली हिस्ट्री, देन हाउ वुड यू मैनेज दैट थिंग, and then try and see which medical insurance or a family healthcare plan is going to be the best you can get for you. My conclusions are, these are my conclusions. ECHS is good for OPD, regular and routine follow-ups, etc. अगर आपको regular OPD जाना है, because once you go to an OPD, the doctor sees you. बहुत सारी चीजें, बिकॉज वो बहुत सारे और पेशेंट्स को देख रहे होते हैं, दे आर एबल टू टेल यू व्हिच प्रॉब्ली यू आल्सो डोंट अंडरस्टैंड as to why this kind of a dysfunction is there in my body. So ECHS is a very good option for regular OPD, for regular and essential checkups, and for routine follow-ups. अब कोई प्रोसीजर हो गया है, सर्जरी होगी, उसके बाद रूटीन फॉलोअप्स के लिए. बट हेल्थ इंश्योरेंस इज ऑल्सो एन इनएस्केपेबल एक्सपेंस. इसको आप एस्केप नहीं कर सकते हैं अनलेस यू आर नॉट रियली बॉदर्ड अबाउट योर हेल्थ. वो आपकी बात है. सो डाइंग अर्ली या पेनफुली सिक रहना, उससे भी बड़ा खर्चा है हेल्थ इंश्योरेंस से. ये अब आपको चूज करना है कि आपके लिए ज्यादा मुश्किल कौन सा है. As per us, you should love yourself sufficiently and try and avail the best possible treatment available as of today. And this is going to get better. If you are in your 40s, another 10 years, the medical care is going to be better. If you are in your 50s, another 10 years, it is going to be better. If you are in 30s, and when you actually need medical care by the time you're 55, 60, the medical industry would have undergone so many iterations, so many technological advances that we don't even know how much more effective they will be in terms of providing longer and better quality life. So, and I can say, seeing this, what I've seen in my family, different procedures, different things, that proper medical care has a very huge possibility of increasing and improving your life of your lifespan, as well as the quality of your life. Both. It can increase your life also, and it can increase the quality of your life also. So our recommendations is, one, do opt for ECHS. I am not making any kind of a case here. Do not opt for ECHS. ECHS in its own regard is a beneficial scheme, especially in smaller cities where hospitals still need patients. They're very keen on taking the ECHS beneficiaries and providing them the required medical health care. So do opt for ECHS. Absolutely no doubt. It is a very effective plan when it comes to OPD. It is a very effective plan when it comes to essential diagnostic expenses. It is a very effective plan for regular medication. So you should opt for ECHS. डिपेंडिंग ऑन योर एज बिल्ड अ हेल्थ इंश्योरेंस प्लान स्टार्ट स्मॉल आप 35 साल के हैं तो जरूरी नहीं कि आपको 50 लाख की हेल्थ इंश्योरेंस लेनी जरूरत है 5 लाख की लीजिए धीरे धीरे नो क्लेम बोनस बढ़ा लीजिए जरूरत पड़े कोई टॉप अप प्लान ले लीजिए सो यू कैन एक्चुअली प्लान योर हेल्थ इंश्योरेंस एंड योर हेल्थ केयर नीड्स बाय पुटिंग time, effort, energy, and getting hold of a person who can help you assessing all these aspects. Compare and buy the बेस्ट हेल्थ अवेलेबल फैमिली हेल्थ इंश्योरेंस प्लान शुड यू बाय ऑनलाइन खरीद लीजिए जाइए पता कीजिए देखिए तो सही मेहनत कीजिए ऑनलाइन और ऑफलाइन में फर्क जो होता है वो बेस प्रीमियम में फर्स्ट ईयर में 4-5% का होता है उसके बाद सब बराबर हो जाता है अगर आपको ऑफलाइन कोई जानने वाला है वो आपको 5% का मतलब है साल का अगर आपका 20 या 25 हजार का प्रीमियम है तो आपको 2,000-2,500 रुपये का फर्क पड़ेगा ऑफलाइन खरीदने में बट क्लेम के टाइम में आपका जो एजेंट होता है वो आपकी थोड़ी सी मदद ज्यादा कर पाता है एज कम्पेयर टू ऑनलाइन बट दैट्स समथिंग फॉर एन इंडिविजुअल टू डिसाइड आइडली स्पीकिंग you should get an individual to help you with this but if you are capable of understanding the plans etc go ahead whatever you want to do when you're buying your health insurance look at options like top up plans critical illness cover especially if there is some kind of a family history you would be knowing your family history those are the underwriting norms even when the health insurance company is asking you to fill up the basic form आप भी इसके बारे में खुद कॉन्शियस थॉट लें और इन चीज़ों को अपने हेल्थ इंश्योरेंस प्लान में इंक्लूड कीजिए ये बहुत कम खर्चे में आपको एक अच्छा कवर दे देते हैं इट्स लाइक यू आर कवर्ड फॉर एनी अनफोर्सिंग थिंग्स और मैं फिर कहूँगा कि एनी काइंड ऑफ एन अनफॉर्चुनेट इवेंट व्हेन इट कम्स टू हेल्थ कैन सेट बैक एन इंडिविजुअल और अ फैमिली बाय अ लॉट ऑफ मनी फॉर at times, buying an health insurance may not be possible because of your age or maybe because of the fact that you have some existing illness. Then, our recommendation to our clients in this situation becomes कि सर आप एक काम करें जो प्रीमियम आप हेल्थ इंश्योरेंस कंपनी को देते हैं उससे थोड़ा सा बढ़ा करके हेल्थ इंश्योरेंस का हेल्थ अपने लिए हेल्थ प्लान का एक SIP स्टार्ट करेंगे ताकि अगर कभी जरूरत पड़े तो आपके पास में एक पैसा इकट्ठा हुआ है फॉर योर हेल्थ और गॉड विलिंग आप बहुत हेल्दी रहे जरूरत नहीं पड़े तो वो आप ही का पैसा सो दैट इज द जिस्ट ऑफ माय टुडेज टॉक आई वुड से repeat at the cost of repetition I would say do buy do subscribe to the ECHS irrespective or your corporate health plan irrespective whether you are a short service commission officer you are a permanent commission officer or you are superannuation do opt for ECHS वो essential है उसके बाद अपनी हेल्थ केयर नीड्स को एसेस करके अपने लिए एक एडिशनल कवर लीजिए बहुत ज़्यादा लंबे चौड़े हेल्थ इंश्योरेंस की जरूरत नहीं है बट जीरो लें ऐसा भी ठीक है तो आई एम नाउ माय पार्ट ऑफ द टॉक जस्ट गिव मी अ मोमेंट है
You gotta focus on yourself, on your faith, on your dreams, on your mind.